Thanks for joining us. Our News 5 at 10. I'm Rob Quirk. Elizabeth off this week. Now to a News 5 investigation. The Veterans Administration, they've promised more transparency, better accountability, improved health care. We've been reporting on that for months now. Well, this comes after the Inspector General's office found hundreds of vets nationwide were dying as they waited months and in some cases years for an appointment. But is the VA actually keeping its promise? Chief Investigative Reporter Eric Ross in studio with new evidence showing some problems still exist. Eric.
Rob, good evening. Alan Cornell had colon cancer surgery last year. Following that surgery, doctors stressed the importance of chemotherapy. But our investigation found Cornell waited months to start chemo because of, quote, miscommunication. And now doctors are predicting he doesn't have much longer to live. Tonight, News 5 investigates. Did the VA fail this veteran?
People need to be upset about this, man. They need to be mad as hell about this.
Navy veteran Alan Cornell never envisioned sitting in front of a camera, but he now feels obligated to share his story.
I contacted you because you were the only way I could get this out. I'm trying to reach as many veterans as I can right now.
In September 2016, Cornell showed up at Penrose Hospital with abdominal pain. It turned out to be colon cancer. Doctors performed surgery and recommended chemo.
You know, everybody was stressing that I needed to get it done now, start now. And the months just kept rolling by, and it wasn't happening.
Despite having VA centers in Colorado Springs and Pueblo, neither offer chemotherapy treatment. News 5 Investigates discovered the only VA center capable of administering chemo is in Denver. Cornell is homeless, making travel difficult.
They said, come up here. I'm like, nah, there's no reason for me to drive 90 miles when I'm 5 minutes away from being treated right here, okay? That was stupid.
So he decided to apply for the Choice Program, which allows veterans to receive health care outside of the VA. Approval into the Choice Program would have allowed Cornell to start chemotherapy at the Rocky Mountain Cancer Center in Colorado Springs, but he hit several roadblocks. Medical records obtained by the I-Team show Cornell applied for Choice on October 21st. It took Choice 3 weeks to come back and say Cornell was, quote, likely not eligible for help outside the VA. A week later, the paperwork is resubmitted for approval. Another week passes, and now it's December. Cornell is finally approved for Choice, but he had to wait another couple of weeks to start his first round of chemo, which took place after December 29th. By then, more than 8 weeks had passed, and it was too late.
The first round of chemo did not work.
We took Cornell's case straight to the top and sat down with Dr. Harold Dillon, the Deputy Chief of Staff for the VA. According to VA medical records, doctors recommended Mr. Cornell start chemotherapy immediately after surgery. That was back in September, but because of the delays in getting approval from Choice, Mr. Cornell wasn't able to start chemo until sometime after December 29th, 3 months later.
Correct.
Is that acceptable?
Let me just say this way. Based on several issues with miscommunication between the Choice Program, between our facility trying to contact the patient trying to contact the Choice Program, those communication barriers resulted in a delay probably of an additional 4 weeks, which quite frankly is understandable but not acceptable.
He believes that had he been able to start chemotherapy immediately and not had the hurdles of going through the Choice Program, the outcome might have been different. Based on your assessment and your knowledge of this situation, do you agree?
There's not any real literature that says if you have chemotherapy at 4 weeks versus 6 weeks versus 8 weeks versus 10 weeks versus 12 weeks that it reduces your risk of recurrence by X amount. That literature doesn't exist.
Dr. Dillon says generally speaking, cancer patients will start chemo as early as 4 weeks after surgery, but reiterates chemotherapy does not guarantee the cancer will go away. It can simply prolong someone's life. Doctors now predicting Cornell's chance of living longer than 5 years is less than 30%. Do you believe the VA did all it could to help Mr. Cornell, or looking back, is there anything that could have been done differently?
From our perspective, I think there may have been some misunderstandings of what really was available in the choice program, and then outside of the choice program, what we could have done through non-VA care.
An I'm sorry or an apology doesn't sit well when you're talking about veterans and health care.
I think the quality of care we provide is above what's provided in the community to our veterans.
Well, Dr. Dillon says the VA has hired new nurses and primary care physicians, built new medical facilities, and purchased new medical equipment. News 5 Investigates found no plans to bring chemo treatment to VA centers in southern Colorado. The VA just moved into a brand new facility down in Colorado Springs.
Right.
So some veterans may look at this and say, you're in a bigger building, why can't you bring this technology and experts down here to perform chemotherapy treatments? We're not talking about 1 or 2 veterans with cancer in southern Colorado. We're talking about dozens.
Right. And it is, I mean, we did move into a clinic that we've outgrown. I mean, we don't have the staff, obviously. We don't have the pharmacy staff to do it. We don't have the facilities there set up to be able to do that.
You heard right. This brand new multi-million-dollar 76,000 square foot facility doesn't have the space or staff to run an effective chemo center.
I know it's a difficult pill to swallow. I realize that. But space is truly a limitation in Colorado Springs.
This news does not sit well with Cornell, who says the VA is dropping the ball on treating veterans with cancer, pointing to delay after delay.
You know, all you got to do is approve somebody's treatment. That's it. The paper comes across your desk. You see that it's urgent all over the paperwork, but yet you're going to set it to the side and say, he doesn't need to be treated now. You know, I'm trying to be a voice. There's more guys out there like me, all right? There's a lot of guys out there like me, but nobody's saying anything, and they need to step up.
Dr. Dillon wants to emphasize the importance of colon cancer screenings, which are usually recommended for anyone over the age of 50. Cornell was 56 when he walked into the emergency room and was diagnosed with colon cancer. Dr. Dillon adds that had Cornell been screened for colon cancer years earlier, they may have been able to remove a polyp before the cancer spread. But Rob, it still doesn't change the fact that this veteran had to wait months to start chemotherapy.
Yeah, that time frame didn't change, and obviously he's paying a price. Okay. We heard in your piece that they're saying there's no plans to establish a chemo center in southern Colorado Springs or Pueblo. Obviously, dozens of VA patients dealing with cancer. Are there any discussions, at least have we moved anything forward to maybe reach that point in the future at some time?
You know, I asked Dr. Dillon that very question. Are there any future discussions that will take place a month or 2 months down the road to talk about bringing chemotherapy treatment to the VA here in Colorado Springs? And he said at this point in time, there are no conversations, but maybe this is a conversation for our lawmakers and mayor, who we will be reaching out to. More to come on this story in the near future. And as always, if you need help or have an issue or problem you'd like us to look into, send us an email anytime. Our information right there at the bottom of your screen, News 5 Investigates @KOAA.